Well, there are no easy answers. I'd separate out Social Security, where I would argue there's not a crisis. There may be an actuarial problem that over the next several years we've got to address, but it's a manageable one. And the problem of Medicare and Medicaid, which are in crisis, and if we don't deal with soon, we're going to be making our children, our grandchildren, poorer. The problem on the health care entitlements is you have an actuarial problem which sends the costs up a little bit per year, and a extraordinarily steep annual increase in costs. And so part of the reason that I think it's so important for us to move forward on health care, an overarching comprehensive health care reform agenda is, and soon, in the next 5 years, is that we can't solve Medicare and Medicaid without addressing the larger inefficiencies of the system. If we're spending $2 trillion a year on health care, twice as much per capita as the next countries, Canada and Germany, that we will not be able to provide coverage to all our seniors without breaking the bank. And I think that commitment to our seniors is important. So if, on the other hand, we can bring healthcare inflation down to the average of other goods and services, then we can manage the problem. So that's part of the reason why on my healthcare plan I started with costs, putting more money into prevention. If we went back to the obesity rates that existed back in 1980, we would save $1 trillion in our Medicare bill. That step alone. So putting more money into prevention, putting more money into the management of the chronically ill, the 20% that account for 80% of the cost to the system, using technology intelligently so that we're getting medical records digitalized, reducing the amount of errors that arise simply because of duplicative testing. All those steps, we estimate we can conservatively save $100 to $125 billion a year. We can take some of that money then to make certain that everybody has coverage. That, over time, will also reduce costs, although it will cost some money on the front end. And as we get a more rationalized system, we can start bringing down the inflation that is having an impact not just on the private side, but also on Medicare and Medicaid.